Management Part 1. Job descriptions for the charge nurse is going to vary by facility. It will usually list the qualifications, responsibilities, and duties of that particular job description. Be sure that you check your state's Nurse Practice Act for specific requirements that are related to your scope of practice. Preparation for being a charge nurse will depend on a variety of factors, such as your state's Nurse Practice Act. And because the Nurse Practice Act will vary from state to state, again, you need to be familiar with the particular state that you're practicing in. Additional education is another factor, as is your motivation to learn the manager role, your ability to be a risk taker, and how you use your nursing experience. According to the 2006 practice analysis by NCSBN to gather data for content areas for the NCLEX PN, 48.2% of LPNs stated that they regularly had one or more administrative roles. 72.4% of those with administrative roles tended to work in long-term care, and 58% of those with administrative roles in long-term care indicated that the charge nurse position was their administrative role. Excuse me. The charge nurse can help a unit run more smoothly by being knowledgeable about job duties and all departments that the nursing assistants have contact with. Charge nurses need information on the function of the facility so they can fulfill their own duties and effectively supervise nursing assistants. So they need to know about the facility organization and the legal aspects, be aware of federal, state, and private agency regulations, know the personnel policies, know the records and unit routines, know unit administration, safety policies, know about housekeeping, maintenance, and supplies, equipment, how to use it and where to obtain it. Knowing where to find equipment and supplies can save a lot of time and frustration. Be familiar with the food service for residents and how to get food when the kitchen is closed. Nursing care procedures and how to assist the physician. Know about medications and med passes. How documentation is completed in the facility. Special areas, and then all of the miscellaneous that is involved in a facility. The facility organization and legal aspects, you've got to be familiar with the facility statement or the mission statement. It is facility based, and it's usually the root care that is provided in that facility. Be familiar with the organizational chart. Know who to go to and whose job is what in order to report issues or praises or to try and get things changed. State statutes for all licensed persons on the healthcare team. Know not only the Nurse Practice Act regarding your responsibilities, but the other healthcare workers that you work directly with. Be familiar with skills checklists for the LPN and nursing assistants and for all cross-trained personnel. Those checklists are going to allow you as the charge nurse to know what areas the healthcare worker has performed, knowing the facility's protocol and the ability to perform the task. Be familiar with job descriptions and duties of the RNs and LPNs and all of the unlicensed personnel. By knowing the job descriptions, it allows you as the charge nurse to know who and what the healthcare team members can participate in. And those federal, state, and private agency regulations. Be familiar with inspection protocols. Knowing those can help you follow an appropriate quality improvement plan versus just getting ready weeks prior to an inspection. Know the state requirements as well as the federal requirements. Those current federal regulations, including HIPAA and state regulations. Know the regulations of the Omnibus Budget Reconciliation Act, the regulations of the Centers for Medicare and Medicaid Services, regulations of the Joint Commission if the facility you are employed at seeks the Joint Commission accreditation. And know the current and up-to-date information, or by knowing the current and up-to-date information, it's going to allow you to educate the staff in what is current. With personnel policies, it's the role of the charge nurse to uphold institutional policies by responding to personnel with accurate information and explaining why they will be or need to be upheld. Be familiar with the employee manual. That manual has knowledge that allows the charge nurse to follow through with policies and procedures relating to the employees. And this will allow the charge nurse to implement and follow through. Be familiar with timesheets, their location, and how to interpret them. Vacation, holiday, and sick leave policies. Requests for special time off or a leave of absence. How do you communicate with reporting on or off duty, sickness, absence, memos, bulletin boards, etc.? What are the meals and coffee breaks? Smoking regulations, the use of facility telephones, and uniform regulations. You need to be familiar with all of those. With the records and unit routines, the general shift routine for days, evenings, and nights. You as a charge nurse may be asked to fill positions on any or all of those shifts. What are the duties of the 3 shifts? For example, a lot of the baths are given during the day shift when there's usually more employees around. But does that mean that they're the only ones who can perform the showers? What are the methods of reporting? Where's the procedure manual and what does it say? How about the facility policy manual? What procedures are specific to the facility that you're working in, and not just the facility that you're working in, but the unit that you're working on? Be aware of the nursing care plan system and what you need to do to maintain it. Some facilities require nursing care plan to be actively reviewed every shift. Sometimes in the long-term care facilities it may be every day or it may be every week. Be familiar with the nursing Cardex and Medex systems. The Cardex is going to be basically a summary of the client and what is going on with the client, what tests need to be completed or procedures are going to be done, etc. Be familiar with routine for care planning conferences, the routine for the physician's visits. How do you transcribe the physician's orders according to laws and facility protocol? Where are the reference books when you need to look something up? Your unit administration. How are clients admitted? Where are they placed? How do you transfer them? How do you discharge them? How do you take care of their clothing and their valuables, including that personal property list? What is the routine when one of the residents is seriously ill? Do you call the doctor? Do you take care of it yourself? Do you call the family, etc.? And how about the routine for the death of a resident? Does the physician need to come in to pronounce death? Do you need to call the family? What do you do with all of the patient's belongings? Is this a case that requires an autopsy? And if so, who's going to complete the autopsy permit? Authorization procedure and forms for any diagnostic tests and surgeries. What are the visiting hours? Is there a notary public around? So when the residents have something that needs to be witnessed legally, a signature, is there someone who can do that? Or do you need to call someone in? Safety policies. What are the policies on the use of side rails or restraints? How about the fire regulations for the facility that you're working in? How do you report a fire? What do you do with the residents if there is a fire? Where are the fire exits? Where are the fire extinguishers? How do you prevent fire? And are there fire drill procedures that you will be expected to participate in? Do you know how to appropriately use the oxygen in your facility? And is there oxygen in each room, or do you have to take portable oxygen in? Is there oxygen concentrators, etc.? How do you transport the residents? Are they ambulatory, or are they chair fast or bed fast? Use appropriate body mechanics and back safety. You don't want to injure yourself taking care of a resident. The door alarms. When a door alarm goes off, you need to be alert to that and what it means. Standard precautions and security policies. Who do you call if there's an issue? Housekeeping, maintenance, and supplies. You need to know all of these things. Where is the linens kept? How are they supplied? Are there any extras around? What about laundering capabilities? Can you do it? Is there someone who does it themselves? Is there someone who is specifically designated to do that? How do you take care of contaminated linens and dressings? What is the procedure if there is a biohazard spill? And whose responsibility is it to take care of it? How do you obtain supplies, including the drugs or the sterile supplies, etc.? Where are they kept, and how do you access them, especially after hours? If something breaks in the unit, then what do you do? How does maintenance know that something needs to be fixed? And it's everyone's responsibility in the unit to try and keep costs down, and that means conserving supplies and appropriate use of equipment. So where is the equipment kept? How do you use it? And where do you get it? Do you know the appropriate way to use oxygen? The appropriate way to administer it? The suction equipment, the beds. Long-term care facilities are well known for having 20 different types of beds in the facility. How do you use them? What about respiratory therapy equipment, etc.? Physical therapy equipment, etc. And we know that residents are not always hungry at mealtime, or they may require a nighttime snack after nighttime snacks have been passed. Where do you get the food? How do you know if the food the resident is requesting is on their diet? How do you change their diet? If a resident has a specific request for a meal, how do you pass that on to the dietary department? When are meals served? What is on the unit stock? Is there special nourishment that individual residents require? How do you assist with feeding the residents? dining room policies, and family tray policies. You need to be familiar with all of these things to be an effective manager. Again, knowing the nursing care procedures such as bathing, mouth care, bed making, temperature devices, all of these things. Again, your basic nursing care. How do you take care of pressure ulcers, turning, etc., collecting specimens? As an LPN, a lot of times you will be asked to be a phlebotomist and draw blood or collect urine specimens or stool specimens. You may be asked to assist with foot care, and there are specific ways that feet should be cared for, especially in diabetic patients. How do you deal with sterile technique? Blood glucose monitoring. What are the facility's protocol for colostomy care, for NGs or gastrostomies, when you have to feed patients or administer medications through them? Again, standard precautions and post-mortem procedures. A patient or resident dies, it's one of the last things that you can do for that patient is treating their body with respect and their family and taking good care of their belongings. Be familiar with the medication system and how you reorder medications that are out, whether it's a stock medication or whether it is a routine ordered medication for a patient. How do you order it from pharmacy? Be familiar with the medication measurement systems and abbreviations. What do you do about any medication errors? Are there specific reports that you need to complete? And of course, you'll have to report it to someone. And knowing how to appropriately do a narcotic count and sources of drug administration. Being familiar with the method of documentation that is done in your facility is crucial. Most facilities are going to computer systems, although some of them still use some paper supplies. Know what forms are used for what particular documentation and what flow sheets are used. How do you transcribe phone orders? Again, incident reports or variance reports. There's some residents who are known as wanderers, and they might have a hearing aid, they may have special equipment that needs to be used. Are there special lists for those, and where are they located? How should they be documented on? What are the federal and state chart forms and requirements? And the private organization, the facility that you're working in, what are their documentation requirements? Also be familiar with the special areas in your facility, such as emergency, central supply, etc. All of the areas. If there is an area in the facility and you are a charge nurse, then you are responsible for being familiar with that area and how it works, what is found there, what you might need to do to be able to retrieve stuff or contact people. Miscellaneous, the paging system or call light system. You need to be familiar with the disaster plan of the facility that you're working in. Very important. Be familiar with what residents are desiring CPR in case their heart stops and what ones are DNRs. What volunteer services are available. If someone is on call to come in for an emergency situation, etc., be familiar with all of this. You've got to know it. How do you handle wanderers? If a resident goes out of the facility for a family activity or they need their hair done, etc. Again, be familiar with everything that happens in your facility to be an effective leader.